A heart or brain operation, a liver transplant, the removal of a kidney, the implantation of a knee prosthesis are all surgeries that would not be possible without anesthesia due to the excruciating pain the patient would experience during the surgery operation. In the past, however, anesthesia was practiced with rudimentary methods, from compressing the patient's carotids to make him lose consciousness, to cold water compresses to slow down blood circulation, from the use of the mandrake, a highly toxic plant with sedative properties, to Spongia somnifera, a sun-dried sea sponge immersed for hours in a deadly cocktail of opium, henbane, nightshade leaves, and other herbs. General or total anesthesia is a medical procedure used especially before long and invasive interventions, as it allows the patient not to experience any kind of pain during the operation. It is a pharmacologically induced temporary and reversible state of coma, in which the patient loses consciousness following the administration of certain drugs. If you want to know what happens to the body when you are in a coma, I leave you the video I made above. There are different types of anesthesia, and during the anesthetic visit that precedes the surgery, the most suitable for the patient will be chosen. The anesthetist will decide on the basis of the type of operation that the patient must do, and on his medical history, inquiring about diseases, allergies, medications taken, previous operations, and other useful data to obtain a complete picture of his state of health. In this video, we are going to see how general anesthesia works. General anesthesia can be divided into 3 stages: induction, maintenance, and awakening. Before surgery, a needle cannula is placed in the vein of the arm or in the back of the hand, a device that functions as a peripheral venous catheter, which allows the administration of tranquilizing and anxiolytic drugs. At this point, the induction phase begins, in which the anesthetic can be administered intravenously or by inhalation. In the first case, general anesthetics such as propofol, ketamine, and ultra-short-acting barbiturates such as thiopental are injected into the veins through the needle cannula. In the second case, however, through a special mask placed on the patient's face, drugs are administered in the form of gas. We talk about gas anesthesia, and it is made possible by a special machine that automatically adjusts the quantity of gas administered based on the patient's breaths. The anesthetic gas most used for general anesthesia is nitrous oxide, which is mixed with oxygen and other halogenated vapors. Other anesthetic gases are sevoflurane, isoflurane, and desflurane. Within the first minute of administering the anesthetic, the patient will lose consciousness, as well as eye movements and laryngeal reflexes. The pupils dilate, and the intercostal and diaphragmatic muscles become paralyzed, stopping voluntary breathing. Endotracheal intubation is then carried out, which consists in passing a tube in the patient's airways, which is connected to a mechanical ventilator, a machine that constantly supplies oxygen to the patient's lungs, and at the same time eliminates waste gases, mimicking the respiratory and intercostal muscles during breathing. The pumping of air into the respiratory tract can also take place through a special mask placed on the patient's face. The second phase of general anesthesia involves the maintenance phase, that is, the time interval in which the patient undergoes surgery, and during which, in addition to being unconscious, he must not perceive painful stimuli. The maintenance of general anesthesia occurs through the continuous administration of hypnoinductors, drugs which, as the name suggests, exert a sedative and hypnotic action. Some of these are benzodiazepines and barbiturates. Analgesics, drugs capable of relieving pain but which do not intervene on the causes that caused it. Level 3 drugs such as strong opioids, such as morphine, methadone, fentanyl, or oxycodone, are used to manage high-intensity pain. Muscle relaxants, drugs capable of relaxing the voluntary and involuntary muscles of the body. Some of these are pancuronium, vecuronium, and succinylcholine. For the entire duration of the surgery, the anesthetist will monitor the patient's vital signs, such as breathing, pressure, and heart rate. as well as ensure that the patient continues to receive the dose of anesthetic necessary to maintain unconsciousness. What happens if the patient wakes up during the operation? It's possible. We will see it in an upcoming video, which as soon as it is available, you will find it by clicking here above. The mechanism by which general anesthesia eliminates pain perception is still not fully understood. The anesthetic drugs administered work by blocking the passage of the nerve impulse from the periphery of the body to the brain and vice versa. The transmission of electrical signals between neurons is interrupted, in particular by blocking the ability of the postsynaptic neuron to receive the message, to bind to the neurotransmitter released by the presynaptic neuron. In this way, the brain loses consciousness and the ability to remember what happened during the surgery, but above all, it is unable to process the pain. In the case of gaseous anesthesia, on the other hand, the anesthetic gases, following inspiration, reach the lungs and alveoli, where it is solubilized in the blood and reaches the central nervous system through the bloodstream, where it carries out its action. The third and final phase of general anesthesia is that of awakening, which occurs by gradually stopping the administration of anesthetic drugs. When the patient's metabolism eliminates them, he will begin to awaken. When he starts to breathe autonomously, the tube will be removed from the trachea and detached from the machine that helped him breathe. Once awakened, the patient remains under medical observation for a few hours. It is at this stage that the side effects of anesthesia, such as nausea, vomiting, drowsiness, slowed reflexes, and headaches occur, as well as pain due to surgery, which is treated with pain relievers.